People think that there isn't an alternative to where we are right now. And there is. There are positive solutions that don't require putting Washington in charge of our health care.
How do you bridge that gap between kicking the president's plan just down the road, saying it's a disaster, and starting fresh, which I guess would be your approach?
Exactly. We do need to start fresh, because the first step out of the chute from the president's plan is that the government runs things. And the American people are seeing right now exactly what that gets you.
All right, the Georgia congressman, doctor by training, talking with me a few years back, saying, you know, Republicans do have alternative plans to the president's health care plan. They just couldn't get past go, especially with an administration that wasn't going to entertain any of their ideas. Now he is Donald Trump's pick for Health and Human Services, and he would likely be approved. Craig Smith is the chairman of Swiss America. His read on all of this. You know, Greg, to give that guy credit, early on, he had plenty of ideas. Early on, he had plenty of market-based ideas to keep prices competitive and low. So it wasn't as if Republicans didn't have ideas. And now he'll be head of the HHS and that $1 trillion budget and the 100,000 folks there. Can he get what he wants?
I believe he can, Neil, and you're right. Dr. Price did not sit on his hands. If you remember, in 2009, he offered up the Empowering Patient First Act, which said, let's go ahead and give tax credits for people who buy health insurance. Let's allow insurance companies to compete across state lines. Let's deal with the ridiculous medical malpractice insurance lawsuits that we have. I mean, this guy went to work right away in 2009 when he knew they were going to be steamrolled by the Democrats and have a bill forced down the American people's throats. And this Dr. Price, I don't know how else to put it, Neil, this man is wickedly smart. I mean, he was 20 years an orthopedic surgeon. He ran his own clinic. He ran a clinic at a hospital. He knows the patient side of it. He knows the financial side of it. But more importantly, he has not been dragging his feet in Congress. I mean, look at his pro-growth budget act in 2014 he tried to get through. He saw the devastating, crushing impact that Obamacare had on people taking full-time jobs and having to go to part-time jobs, and companies that wanted to expand past 50 and had to stop. So I'm excited about this. As a businessman, Neil, this is one of the better picks that President-elect Trump has made, in my opinion. This guy is going to do a terrific job.
You know, another thing to think about, too, is it confirms that Donald Trump is quite serious when he says about dismantling Obamacare. This is just a more technical question for you, but is that doable? I mean, obviously, one of the things you first discover is, like any bureaucracy, it has gotten entrenched in the system and entangled. And, you know, now you're talking about whatever Republicans come up with. What do they do about the 20 or so million Americans who have health insurance? How do they cover them in the interim, switching to this, whatever the new product will be?
Well, we have obviously Medicaid, you know, that can fill the gap, and Dr. Price understands how that works. But I got to tell you something, Neil. Now, this is just conjecture on my behalf, okay? But I believe Donald Trump is going to repeal Obamacare, as he said, and he's going to replace it. And I happen to believe that Dr. Price, along with Jason Chaffetz and some of the others, are already working. Look, they've got all the structural pieces in place from all these bills they offered up in the past. All they have to do is have a bill waiting on President-elect Trump's desk come January 21st, and it be a practical bill. You can start going out of the Obamacare and into the new plan. And here's an important point, Neil. There was a little House resolution passed called 1990, which restricted the Treasury Secretary from implementing any part of Obamacare that wasn't already written into law, that the law was signed. Many of those things are not going to be signed till the last few days of Obama's administration and go into effect in 2017. That's why in Arizona, we could see a 118% increase in premiums. I've got a sheet here that shows it.
No,
I had to print it out for me.
And not only there, a lot of other states. Craig, thank you very much. Very good seeing you again.
Good seeing you, Neil.
All right, by now you have heard about this crash, this